Dr. Davidhizar, we did talk about arthritis, and you mentioned there's a few of them and there's hope for them. And one of the things you mentioned is that repeated actions with the joints or the whatever, is part of what brings it about. Now, what's the difference between arthritis and carpal tunnel syndrome, for instance? Is that the same thing, or is that something totally different? Because it seems to be coming from repeated actions, whatever it may be. Tennis elbow, same thing. Are we talking something totally different here?
Right. Well, the repetitive motion injuries are different than arthritis. They sometimes give the same symptoms because the joints hurt, but those usually can, with rest and with medications, we can usually make those all go away. The osteoarthritis is more chronic, so it doesn't go away as easily, but there are treatments for that too. But with like tennis elbow, there's injections you can do for that. Some of the new things we're doing with the plasma-rich the platelet-rich plasma also helps tennis elbow and those sort of things too. But the old standard was to inject it with steroids, and that almost always solves the problem as well. And then, of course, the other thing is if it's a repetitive use, you want to have the person stop doing those things for a while. Sometimes you'll splint the joint to immobilize it for a while, and that helps as well. But frequently it takes a steroid along with that to get the problem to completely resolve.
So a writer who writes one book after the other one or types one letter after the other one for his or her boss, how do you tell him to stop typing away from his computer?
Well, the other thing, too, about your computer, you got to make sure it's all ergonomically correct so you don't put any undue stress on your joints that isn't necessary. But most people that do something all the time, if they've been doing it all the time, usually don't have trouble. It's when you start a new activity that you're not used to is most of the time where we run into trouble with the repetitive use injuries. Because eventually your body adjusts to doing the same thing over and over again, and the muscles get strong, and you tolerate it fine.
I see. Well, that makes sense because when sometimes I go on a writing binge, for a couple, 2-3 weeks, and I come home from work and I write every day a couple hours, then kind of I get it. But basically, that's not because I've done it so often repetitive. It's because I have not typed for a while so much. So then when I do type, it's basically almost like a sore muscle, basically.
True. So if you do a new activity, if you ease into it, so try to do it all at once, that usually helps prevent those injuries.
Okay. All right. So basically you inject steroids and stuff for carpal tunnel also, or only for the tennis elbow type of thing, or is that all the same?
No, you can do it for tennis, for carpal tunnel as well. And lots of times that works too. Carpal tunnel, of course, I split people so they don't, especially at night, so they don't sleep with their hand, their wrist flexed. That's what causes all the trouble. So there's lots of different things you can do, but the injections also work for carpal tunnel frequently. Not always, but usually they do.
And when you inject this, what you say was it?
Plasma-rich protein?
Yeah, when you inject that in the elbow for a tennis elbow, will I play tennis better than after that too? Does that help for that?
No.
It doesn't?
But you'll be able to play tennis again, though.
Oh, okay. So I can get beaten again, right?
Right.
Okay. Thank you very much. Very informative, Dr. Davidhizar.
You're welcome.